Welcome to the AUANews Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Hi, welcome to the AUANews Inside Tract. I'm Dr. Tim Bukowski. I'm a pediatric urologist and proud recipient of the recent Urology Care Foundation's Humanitarian grant.
Hi, and I'm Valre Welch. I'm a pediatric nurse practitioner in pediatric urology and a member of the Belize Multispecialty traveling team and have been for quite a while. So I'm excited to be here with you today.
Yes, thank you, AUA Foundation, for helping get this podcast organized. In this episode, Valerie and I will take you behind the scenes of our recent medical mission to Belize, which was supported by the Urology Care Foundation Humanitarian grant, where our team provided multidisciplinary care ranging from pediatric urology and pediatric nephrology, with some developmental pediatrics and even orthotics. So let's dive in. Going back a couple of years, Valerie, can you remind me when we first started working together in this mission?
I think the first time you and I worked together, Tim, was we both attended a spina bifida conference in Belize in 2004. So that was a while ago. There were many professionals from around the area, and it was an excellent conference to get this whole idea started of trying to provide more current care to all of the spina bifida patients in the region. After that meeting, certainly the mission has grown significantly. How do you think World Pediatrics has helped to make this a much more effective mission for the people in Belize?
Well, certainly when I first started coming down to Belize, I came at the behest of a local pediatrician who had happened to work in the U.S. And I went down with just myself and under the guidance of that pediatrician and his small group of local community organizers. And after the forerunner of World Pediatrics became kind of involved in development of these kind of missions, they took over this pediatric urology mission and grew it not only for our group, but also for orthopedics, ophthalmology, ENT, and general surgery. So the whole mission from the U.S. to Belize and all of the Caribbean area has grown dramatically since 2004, thanks to the World Pediatrics Organization. So as this mission has grown, of course, and it's been quite a long time we've been working together, Valerie, what motivates you to be still part of the mission? In other words, what keeps you coming back year to year?
It's hard to describe just how rewarding it is to work with a population that is so receptive to having care, who would, without the World Pediatric Group and pediatric urology coming, they wouldn't have anyone to take care of some of these patients. And they've had a fairly significant number of spina bifida patients in the country, as well as patients with congenital urology issues that otherwise would not be taken care of. And I've enjoyed watching some of my patients grow up and see how much more effective they are in their lives and in taking care of themselves.
Yeah, that's one of the fun things about World Pediatrics is it is a continuity of care. It's just not a drop in and drop out. It's the continuity of care which makes our missions more personable and effective and rewarding.
And it's been interesting to watch how much the organization has grown in terms of getting involved in other kinds of activities within the population of Belize and the pediatric kids. So they expand what they do besides just having surgical missions come.
Well, and speaking of that, last year I think we did see about 77, and we usually see about 120 patients or so in the clinic, which involves not only our urology surgical world, but also you as a nurse practitioner in helping, bowel and bladder management and the pediatric developmental pediatrician and the pediatric nephrology are more clinic based. We did, I think, 23 surgeries last year, which was phenomenal. Um, can you just, and one of the things that you did last year that you don't always do, but you went out to visit the folks at the Shipyard Village, a local or rural community. And what stands out when you go to the rural areas when you help to coordinate the care for the patients and do you train some of the nurses in the region when you're going to the communities?
Yeah, when I went to the shipyard last year, which is basically a Mennonite community, and there's a large Mennonite population in Belize, it was very interesting to be able to teach some of the nurses some of the newer concepts in terms of care for some of these patients. We spent a lot of time working on how to do intermittent catheterization for a lot of these kids that they see and providing them printed materials on catheterization. We also talked about more of the congenital anomalies that they sometimes will see because they had questions about the patients that come from their community and have seen us and have had surgery. So it was very helpful for them to have a better understanding of what was going on with the child and how we helped and how they still needed to be involved with their care.
Yeah, that's a great aspect of why we provide mission care to these to patients because although nurses and professionals can look up how to do things on YouTube or the internet in general, it's really the personal interaction that um, makes it much more lasting and worthwhile. And I think it's a lot more effective in general for a care of patients.
And it was nice to reinforce for them what they were doing and to congratulate them on on the progress they'd made in working with some of these kids. So they were very receptive and really interested in what we did and how they could help their community um, across the different conditions.
Yeah. One of the things that we were able to do last year during the clinic, which is progress, is we were able to use deflux material for patients with vesicoureteral reflux. And I think that's the first time we had access to it, um, thanks to the folks at Teleflex, where they have a program. They're able to donate some syringes of a very expensive material, which we take for granted in the U.S., but it's so uh, economically effective. I think more in some of the missions that we service than in the U.S. Not only because it's easier for the care of the patient and there's less um, uh, post-operative issues that the family faces, but also the family can get back to work much more quickly and don't have to spend a week in the hospital with the child as they would if it was a typical ureteral reimplant.
And it
Um,
also helps that and their child isn't having repeated urinary tract infections and being ill and having to see the physicians in Belize and families worried about what's going on and damage to their kidneys. So, yes, I think the ability to bring deflux down there was a significant change in the care that we're able to provide.
Yeah, that was one thing. And the other thing is, of course, when we go to clinic, we we do see patients along with developmental pediatricians, nephrology, and the orthotics folks that are there to help with the spina bifida kids who've had um, orthopedic procedures like 6 weeks before we get there. So they're able to follow up on those patients and provide them with their splints after taking off castings and so forth. What do you think makes why do you think this multi-specialty model is so powerful, especially for families in Belize?
It makes it so much more convenient. I mean, we have our clinic in one part of the country, and patients have to travel long distances,
Mm.
in some instances. So, being able to see multiple, specialists at the same time and get answers to their questions and care for their children makes it a much more effective model. And I mean, it's a model that we use in the States, but I think it's so much more effective and meaningful in a country where, I mean, patients sometimes travel for hours, 4 hours or more on a bus to get to our clinic. So that provides them with a much more well-rounded care, and it makes them feel like their children are really being taken care of from all aspects of their needs.
Yeah. One thing that I've noted since we've been working together over the years and the mission's grown is that we've matured the mission as well. With World Pediatrics coming on, they're enabling us to do not only work with the patients in country, but also we have an opportunity to do telehealth with the electronic medical record system that's been set up by World Pediatrics. That's been a huge benefit over the last 5 or 6 years that I think not only the patients benefit, but also our host coworkers in Faye and Candice and Milagro. It's easier to get a hold of us, and they feel more empowered to help further the care of our patients. And so we still have a lot more. We talked about this last year. There's still a lot of growth for our mission that we can pursue, not only in how we deliver direct medical care one-on-one, but also in workforce development, which you've been working on with the nurses, and also with development of infrastructure growth. Do you see any other areas of opportunities?
Well, certainly, we're now looking at working with the School of Nursing there in Belize to help provide education. I think we've worked with the country itself on trying to um, get a folic acid program going, which would benefit our patients with spina bifida, and just the education that we can provide um, that wouldn't necessarily be as readily available. So they've also started doing a program with the nurses to taking care of their premature babies in their NICU, which
Mm.
has made a big difference. And they outreach to all of their regional hospitals in order to provide a sense of fulfillment and being comfortable in the care of these tiny babies. So they've
That's
expanded a lot with the help of World Pediatrics.
and with the Ministry of Health in Belize, the World Pediatrics and the folks in country, Milagro and Candice and Faye, have really worked with the Ministry of Health in Belize to help organize more structure for our missions to further how much benefit we can provide them. In fact, I think the surgical area, the operating room at the Corazal Community Hospital, was constructed by the Ministry of Belize with the idea that it will facilitate mission groups coming to the country to do work, so we don't get in the way of their day-to-day work from the urologists or surgeons that have to earn a living in their country.
Correct. Yes. They've
Let
really
me
that's really made a big difference, and their ability to communicate with the citizens of Belize so that they're more aware of what's available and when we're coming to the clinic has been another big asset with having in-country um, members and the organization there.
That is probably one of the ways I think that our organization is much different from some of the other mission groups that might travel and provide care in various countries around the world, is that constant presence and a constant contact for the Ministry of Health or local community healthcare providers. Let me just ask you a question. Last year, who was the most meaningful patient, or what was the most meaningful patient interaction on the trip? There's always always a couple that are really just stand out.
Well, I have been taking care of some of the spina bifida patients now for, well, since 2004. And a very rewarding aspect of it was two of our patients have become mothers. And I was able to meet with the patients that we knew and meet their new babies who were nice and healthy, um, and talk to them about motherhood and how they can take care of these little kids. But that was really rewarding to see how much these patients have grown and matured and how well they take care of themselves now. So this is really fulfilling, rewarding.
I agree. I mean, there are patients that I get to see year after year, and honestly,
Mhm.
sometimes I don't need to see them medically, but socially, I think they feel invested in us and want to come visit and see how we're doing as well because of the relationships we
I
built
think
over the
that's true.
years.
Right,
Relationships
right.
are one of the most rewarding parts of what we're able to do. And in fact, relationships with some of the organizations that help us provide the care, such as Corozal Community Hospital, the donors like Teleflex, the Mercy Medical Angels, and of course, the Urology Care Foundation. So,
There's also Friends of Pediatrics in Belize that has been active in working with us as well as all of those organizations from outside the country.
yes, they've been around since the beginning. They're the group that I came down to work with um,
Mhm.
way back in 1999.
When we have clinic, we have volunteers that are students. We have volunteers from the different hospitals. So we incorporate a lot of the Belize community and I think it makes them feel good that they're giving back to their community and that they feel that we are there to help them and not just take over, but teach them and reinforce what they're doing.
Right, being our partners. What do you hope the
Right.
clinicians listening will understand about the needs in Belize and other similar communities? And in when we come for a mission, in other words,
I think they
if you were a message to the to a young medical student or a young nurse or a young physician, what would you say is important to remember when going out on mission?
Well, we're there as their guest for one thing. So the cultural differences are extremely important and that they're not everyone is as fortunate as the folks in the United States are. And they really are appreciative of the care and consideration that we provide for their patients. And they really want someone to help take care of their children and their communities. So thinking about giving outside of just the United States and providing that opportunity, it's a very eye-opening experience when you realize how different life is in some of these other countries, and how the medical care is very, very different.
I totally agree with you on that. In fact, I think one of the biggest draws for working in a mission in another country is you learn about yourself as well. Not only how you can learn about other communities and cultures, but also how you can kind of I don't know, MacGyver things sometimes where you have to figure out how to get by with less or without the exact equipment that you may have had in the U.S. And you become creative and you become willing to depend on first principles really to take care of some patients. I find that super rewarding, and and I think that
Yeah, get out of your zone of comfort.
it pushes you a little bit more.
Yes.
So,
And it's good. It makes you feel like you're thinking and providing for someone else, and it's it's just a very rewarding it reinforces your own education as well as being able to share that knowledge with other folks.
s- so we've been doing this for a long time, Valerie, a couple decades. I hate to say it, but it's true. And but this was the first year we had the American Urological Care Foundation grant to help us, and I think it made a big difference in our ability to get the mission done. We were able to bring Dr. Ree down with us as another pediatric urologist and helped her see how she can help further the program. And also, we've able to bring down residents and medical students when we have grants in support. So it's really important for the next generation to see this firsthand of what we've kind of developed and take it to the next level, I think.
I agree. And I don't know that folks really understand how expensive these missions can be. I mean, we bring many of our supplies, but we have to purchase the supplies and we have to all take time off, and it's something that you don't always think about until you actually have a chance to get involved in one of these medical missions.
Yeah, I mean, I obviously would encourage people to apply for the Urology Care Foundation humanitarian grant. Um, it, I think one big reason to do that is to get involved with hands-on and learn about yourself. If nothing else,
Right.
other than all the altruistic reasons of helping others and 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 providing care for others, you learn so much about yourself, and and you feel good about the relationships you develop and the interactions with other providers, professionals, and those memories last forever.
It also gives you a different perspective on things here in the United States.
True. Because, and honestly, we also, as part of our mission, if we can't provide the care in country, we are able to bring the patients back to the U.S. through World Pediatrics, which is a very uh, large part of what World Pediatrics and the organization umbrella organization provides, helps us provide continuing care. And you've had a
Right.
chance to take
They
care
are
of some of those
responsible.
patients.
Yeah. They bring other patients, not only urology, but they've been very influential in providing care for some very, very sick children in Belize that otherwise they would not have been able to receive that care.
Yeah, I've
So
been
the
involved
grants are
in
helpful.
our own hospital system and trying to encourage it to become a partner with some of the out of country patients, so we could provide care in my hospital with some of these out of country patients. Um, and I'm working on it. I know the young people, um, nurses and physicians, they want to travel, they want to experience, and by bringing patients from other countries to my hospital will provide them a firsthand glimpse of and connection with allowing them to make that next step.
Exactly. It makes a big difference when we bring those patients to our hospitals and our professionals help to take care of them. And they have a better understanding of what care in a more worldwide perspective is like. It's hard for those moms to come up to this country. They have homesickness, the food is different, all kinds of things
Mm.
that they need to adjust to, and I think that helps our professionals have a better appreciation of total health care for a family.
Yeah, agree. Well, this has been a great talk today, discussion, Valerie. Thanks for everyone for joining us and letting us share a little bit of how this mission is run and what it means to us, what it means to the families in Belize and other Caribbean countries that we work with, and of course to the broader urology community.
If you'd really like to learn more about the Urology Care Foundation's humanitarian program, go to urology-health.org/humanitarianism, um, and become more involved in this whole process.
Well, thank you, Valerie, for outlining how folks can get involved, and it's something no one will ever regret. We'll see you next time.
This has been an AUANews Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.